We're getting some news just coming. This is a big story we are breaking at this hour. Precaution dose to be now available to 18 plus population group from the 10th of April 2022 this year at private vaccination centers. Ongoing free vaccination program through government vaccination centers for first and second dose as well as precaution dose to healthcare workers, frontline workers and 60 plus population would continue and would be accelerated. So in just 2 days from now, we will have the precaution dose being given out. This is popularly called the booster dose. Milan Sharma getting us a big story at this hour. Finally, a demand of many people at a time when there is a lot of concern that there could be another variant sparking off another wave, Milan. And that's the reason why further boosting is required.
Yes, Neha. In fact, this comes to an executive decision that has been taken to provide the precautionary dose to all above the age of 18 years in the country. Now, this was a question that was being asked time and again by a lot of people who have comorbidities, who are diabetic, who have hypertension in the country, and they wanted to secure themselves by getting the third precautionary dose, as we call it in India. Now, the government of India has decided that all above the age of 18 can get their third precautionary dose if they have finished their second dose 6 months or 9 months before at a private vaccination center. Essentially, anyone who can afford to pay for the vaccines that are currently available in the country can go forward and get their third dose starting 10th of April. The government continues to do the government immunization program as well, but this is for all those who wish to now themselves go forward and take a precautionary dose, just as we are looking at emergence of a recombinant variant XE as well. But it comes timely, Sneha, because just yesterday we asked Dr. Balram Bharkar whether we'll be looking at all people eligible for a precautionary dose, and they had said the government is actively looking into this, and they are aware of the fact that there are challenges in future as well when it comes to the pandemic. So big announcement from the government of India at this moment. But certainly this only will be available at private vaccination centers where people can pay for the vaccines, whether it's Covaxin or Covishield. At the moment, it will be the same vaccine for the third precautionary dose as well, because this is another question that will be very important, because the studies on the mixed dose have still not come out. There isn't data to show that you can mix your doses. So the third precautionary dose will be of the same vaccine that you have taken previously for the first 2 doses, Neha.
Absolutely. And the rules, Milan, always remains the same for those people who've been infected before. The wait is going to be for 3 months. And also importantly, this is, remember viewers, for those above the age of 18. So there's no specific category for those who want to be vaccinated. Everybody can avail of this benefit. Milan.
Yes, certainly. In fact, right now, there was a category in the 60 plus which had comorbidities. That was also removed by the government. All above 60 years can take the third precautionary dose. Similarly, there isn't any category for people below the age of 60 as well, above 18. Anyone who feels that they require to take a third precautionary dose, this is for people who are comorbid, who have diabetes or hypertension or cardiac illness or any sort of ailment, can protect themselves by getting vaccinated at a private vaccination center near them. The process will be exactly the same as being followed. But from the 10th of April, registrations on COVID will begin and people can move ahead if and only if their second dose has completed a regime of about 6 to 9 months. So if you've taken your second dose, it's been 6 to 9 months for you, then you can move forward to take the third precautionary dose. Below the age of 16, but above 18. So no third dose for children at the moment, because children's vaccination is going on separately, and the doses will cost a price. This is not going to be part of the free vaccination drive in the government centers. Only in private centers is where these third precautionary doses will be administered to people.
Yes, and to tell our viewers, Milan, the rules remain the same for precautionary dose. That definition essentially hasn't changed. If one has been infected in the last few months or so, the wait has to be for 3 months from the day the person turned negative, isn't it?
Yes, absolutely. If you've recovered from your infection recently, then you have to wait for at least 3 months to take the precautionary dose. But the government has made it clear that the precautionary dose as well is only after completing 9 months of the administration of the second dose. And so far, about 96% of all 15-plus population in the country has already received their one dose, and 83 above the age of 15 has received both doses. And the government continues to run the ongoing free vaccination program as well. That will remain the same, but this is only for those of people who are now eligible and willing to take the third precautionary dose, because there were a lot of questions that were surrounding the third precautionary dose. Some people who had comorbidities wanted to go ahead and take these doses, and now the government has opened up essentially a door for all those who are waiting for a third dose.
Milan, for the benefit of our viewers, do take us through the details of how the booking essentially can be done through the COVID app, and also on what one must be careful about, in the sense that the dose has to be the same as the one that has been taken in the past, because there has been a lot of speculation about a third vaccine being used as a third dose essentially, isn't it?
Yes, so essentially the precaution dose is going to be the same the dose that you've taken before. So if you've taken Covishield, you will take Covishield again. If you've taken Covaxin, you will take Covaxin again only. Because, Sneha, you and I have both been discussing the data for the mixed vaccine is still not out. Those studies are still being done both at the CMC Vellore as well as in collaboration with ICMR. And that will take some time. So till such time, the government has decided that the stocks of vaccine are available. The essential registrations will happen through CoWIN as usual. If you've already had your second dose, then you can go ahead and register for the precaution dose at the private center. You can also walk in for registration. You can do your online registration, and you can go to the private center, pay for the vaccine, and then get your third precautionary dose.
Milan, be with us. Dr. Naresh Trihan is now joining us. Thank you for your time. Doctors have been talking about this, and many others also have been asking why the precautionary dose is not being given out to the general population. How do you look at this development today, with the Government of India announcing that the booster dose, or the precautionary dose as India is calling it, is going to be rolled out for everybody above the age of 18? Dr. Trihan.
No, that's very welcome news. In fact, coincidentally, in an interview with India Today yesterday at the John Hopkins Summit, that I said the same thing, that I think clinically we are seeing a big difference in people who have had booster doses and the ones who have either not been vaccinated or not been boosted. So because of the protection most definitely seems to be there in a clinical setting, that I think it's a very good decision, very welcome news, that this kind of protection is going to be available to all our citizens above the age of 18. So I think it's overall a very positive step.
Okay, but there was a lot of conversation, Dr. Trihan, about the third dose being that of another vaccine for better immunity, is what was being said essentially by many vaccinologists. But this has not happened. The government has made it very clear that the third dose is going to be of the same vaccine that you got previously.
You see, the basic thing is that data is actually non-conclusive. And the basic thing is that the decision taken by the Government of India is also on scientific basis, to say that there is evidence in other countries also that the same dose as the booster dose is having enough response to raise the antibodies. So I think that this is still a little bit of gray area, whether it should be mixed or not. But the good enough that the same one is being prescribed, and at least it is giving protection to people. So I think it's a very, very welcome news, and it will help to protect our country from future infections.
Dr. Trihan, what has been your observation as far as uptake of vaccines concerned, given that cases are at an all-time low right now? Even deaths have reduced significantly in the country, and by and large we see that the data seems to be suggesting that there is not much of a demand when it comes to vaccines. What would be your message to people today who are due their third dose?
So I think that it is very important to understand it's too early to let your guard down, because of the fact that this happened even before Omicron came around, that there was a gap and we all felt that maybe the third wave will not come, but it did come. And now we are seeing the new variant, the XE, being detected more and more, and it's even arrived in Mumbai, that there will be that possibility that another wave will come, or that more and more people will get infected. So I don't think that holds any argument about the fact that protection still needs to be continued. And I think that it's too early to let our guard down. So that's why our advisory that if you're going to be in crowded spaces, you still must put on a mask. And in open air, maybe you can be a little more relaxed. But I don't think that we should be careless right now. Progressively, if we see that none of the infections are spreading again, then of course we can gradually come back to normal life.
All right.
But right now it's a little early. Okay.
I appreciate you joining us, Dr. Naresh Trehan, for sharing your perspective on that extremely important development. That announcement has just come in from the Ministry of Health and Family Welfare, making it clear that booster doses or precautionary dose or third dose, as India calls it, is going to start from the 10th of April onwards, and it is open for the entire population above the age of 18 is what the government of India has announced at private vaccination centres. The vaccination program otherwise will not be disturbed, and the precaution dose for healthcare workers, frontline workers and 60+ population would continue and would be accelerated. The government has also in fact said that about 96% of all 15+ population in the country have received at least one COVID-19 vaccine dose, while about 83% of 15+ population has received both the doses. So teenagers in the country have also received vaccines against COVID-19. About 96% of the population above the age of 15 has received one dose. The big headline today when it comes to the pandemic, booster doses, as popularly it is called, also called the third dose or the precautionary dose in India, to start for all above the age of 18 from Sunday onwards, essentially. On the 10th of April is when this program starts.